So, the reason why runners get lateral knee pain starting at their hip and going down to the side of their leg is because while you're running, you actually balance on one leg for a split second. So Genevieve here is going to balance on her right leg and get into a runner's pose. As you can see, the weight shift onto her right leg causes the muscles in her hips to tighten up. These muscles, piriformis, glute minimus, and medius, attached to her IT band, which I told you attaches to lateral hamstring, lateral quad, lateral knee, comes all the way down to her tibia. As you run and you balance on, in this case her right leg, all of these muscles and tendons get tight, causing lateral and front of knee pain. That is the reason why you get signs and symptoms of knee pain going up and down stairs while you're walking in your house and at work, why you'll get knee pain driving a car, why you'll get knee pain after sitting for a long period of time. Okay? Again, it's because your whole lateral structure gets tight. Okay? So this is why you have to stretch your piriformis in the back that comes over and attaches to your greater trochanter, your glute minimus and medius that attach to your greater trochanter, your tensor fasciae latae, hip flexors in the front that again attach. All this has that layer of IT band that goes all the way down the side of your leg. So you have to stretch IT band, lateral quad, lateral hamstring. It is important that you also stretch front of your quad and back your hamstring, but you have to stretch these lateral structures because they're going to tighten up the most when you're running. When do you stretch? We talked about that. You have to stretch a little bit before, a little bit after. You can even stretch during your run. So, I previously talked about the calf muscles, gastroc and soleus, the last layer that attaches to the bone. Underneath gastroc and soleus, I call Tom, Dick, and Harry. Okay? Tom stands for posterior tibialis, that it goes under and then it comes on the inside of your arch. Dick, which is flexor digitorum, that goes to your toes. And Harry, which flexor hallucis, that goes to your big toe, or on your hand, your thumb. Tom, Dick, and Harry start on the back of your leg attaching to tibia and fibula. They come down, they go on the inside of your arch in between your Achilles and this bone here called your medial malleolus. Now, the reason why I'm talking about these is when they come down and go into your arch, they help maintain your arch while you're running. This is why it's important to not just stretch your calf muscles on the ground, but also to do the step stretch. It picks up your plantar fascia, which I'm going to show you in a minute, Tom, Dick, and Harry, and 3, your Achilles and your soleus. Okay?